Alpha-lipoic acid. What is alpha-lipoic acid? Alpha-lipoic acid is an antioxidant that occurs naturally in the body and is also found in foods. It is used to break down carbohydrates and generate energy. Alpha-lipoic acid can be ingested in foods such as red meat, carrots, beets, spinach, broccoli, and potatoes. It is also available in supplements. Because alpha-lipoic acid appears to function as an antioxidant, it may provide protection to the brain and may also be helpful in certain liver diseases. People most often use alpha-lipoic acid for nerve pain in people with diabetes. It is also used for obesity, vertigo, aging skin, high levels of cholesterol or other fats in the blood, and many other purposes, but there is not good scientific evidence to support many of these other uses. How effective is it? The efficacy rating for this product is as follows. Possibly effective for nerve pain in people with diabetes, diabetic neuropathy. Taking 600 to 1,800 mg of alpha-lipoic acid by mouth or intravenously seems to improve symptoms such as burning, pain, and numbness in the legs and arms in people with diabetes. Lower doses of alpha-lipoic acid do not seem to work. Intravenous products can only be given by a healthcare provider. High levels of cholesterol or other fats, lipids, in the blood, hyperlipidemia. Taking alpha-lipoic acid for up to 4 years seems to lower total cholesterol and low-density lipoprotein, LDL or bad cholesterol in people with or without hyperlipidemia. Obesity. Alpha-lipoic acid intake may slightly reduce body weight in overweight adults. Possibly ineffective for liver disease in people who drink alcohol. Daily intake of alpha-lipoic acid for up to 6 months does not improve liver function or reduce liver damage in people with alcohol-related liver disease. Vertigo. Taking alpha-lipoic acid along with vitamin C and vitamin E does not seem to prevent vertigo. Nerve damage in the hands and feet caused by treatment with anti-cancer drugs. Taking alpha-lipoic acid during chemotherapy with cisplatin or oxaliplatin does not seem to reduce nerve damage in the arms and legs caused by chemotherapy. Kidney damage caused by contrast dyes, contrast-induced nephropathy. Taking alpha-lipoic acid with or without standard hydration therapy during coronary angiography does not seem to prevent kidney damage caused by contrast agents. Diabetes. Taking alpha-lipoic acid or intravenously does not improve blood sugar levels in people with type 1 or type 2 diabetes. Vision problems in people with diabetes, diabetic retinopathy. Taking alpha-lipoic acid daily for 24 months does not improve eye damage caused by diabetes. Dementia in people with advanced HIV, AIDS. Taking alpha-lipoic acid has no effect on thinking problems in people with HIV. High levels of fats called triglycerides in the blood, hypertriglyceridemia. Taking alpha-lipoic acid by mouth does not seem to reduce triglyceride levels in most people. There is interest in using alpha-lipoic acid for other purposes, but there is not enough reliable information to say whether it might be helpful. Is it safe? When taken by mouth, alpha-lipoic acid is possibly safe for most adults when taken for up to 4 years. It is usually well tolerated. The most common side effects are headache, heartburn, nausea, and vomiting. When applied to the skin, alpha-lipoic acid is possibly safe for most adults when used as a cream for up to 12 weeks. It may cause a rash in some people. Special warnings and precautions. Pregnancy. When taken by mouth, alpha-lipoic acid is possibly safe. It has been used safely during pregnancy at doses up to 600 mg per day for up to 4 weeks. Breastfeeding. There is not enough reliable information to know if alpha-lipoic acid is safe to use during breastfeeding. Stay on the safe side and avoid use. Children. Alpha-lipoic acid is possibly safe in children 10 to 17 years of age when taken by mouth at doses up to 600 mg a day for 3 months. But it may not be safe for children to take large amounts of alpha-lipoic acid by mouth. Seizures, vomiting and loss of consciousness have been reported in children 14 months to 16 years old who took up to 2,400 mg of alpha-lipoic acid as a single dose. Surgery. Alpha-lipoic acid can lower blood sugar levels. Alpha-lipoic acid may interfere with blood sugar control during and after surgery. Stop taking alpha-lipoic acid 2 weeks before elective surgical procedures. Excessive alcohol use/thiamine deficiency. Alcohol can reduce the amount of thiamine, vitamin B1, in the body. Taking alpha-lipoic acid when there is a shortage of thiamine can cause serious health problems. If you drink a lot of alcohol and take alpha-lipoic acid, you should take a thiamine supplement. Are there any drug interactions? Moderate. Be careful with this combination. Thyroid hormone. Alpha-lipoic acid appears to decrease thyroid hormone function in the body. Taking alpha-lipoic acid with thyroid hormone may decrease the effects of thyroid hormone. Cancer drugs, alkylating agents. Alpha-lipoic acid is an antioxidant. There is some concern that antioxidants may decrease the effects of some drugs used for cancer. If you are taking cancer medications, check with your healthcare provider before taking alpha-lipoic acid. Cancer medications, anti-tumor antibiotics. Alpha-lipoic acid is an antioxidant. There is some concern that antioxidants may decrease the effects of medications used for cancer. If you are taking cancer medications, check with your healthcare provider before taking alpha-lipoic acid. Medications that slow blood clotting, anticoagulant/antiplatelet medications. Alpha-lipoic acid might slow blood clotting. Taking alpha-lipoic acid along with medications that also slow blood clotting may increase the risk of bruising and bleeding. Minors. Pay attention to this combination. Diabetes medications, anti-diabetic medications. Alpha-lipoic acid may lower blood sugar levels. Taking alpha-lipoic acid along with diabetes medications can cause blood sugar to drop too low. Monitor your blood sugar closely. Are there interactions with herbs and supplements? Herbs with thyroid activity. Alpha-lipoic acid may affect thyroid hormone production in the body. Taking it with other supplements with similar effects may alter thyroid function too much and cause side effects. Examples of supplements with this effect include bugleweed, lemon balm, and tiratricol. Herbs and supplements that can lower blood sugar. Alpha-lipoic acid may lower blood sugar. Taking it with other supplements with similar effects may lower blood sugar too much. Examples of supplements with this effect include aloe, bitter melon, cassia cinnamon, chromium, and prickly pear cactus. Herbs and supplements that can slow blood clotting. Alpha-lipoic acid may slow blood clotting and increase the risk of bleeding. Taking it with other supplements with similar effects might increase the risk of bleeding in some people. Examples of supplements with this effect include garlic, ginger, ginkgo, nattokinase, and Panax ginseng. Are there any interactions with food? There are no known food interactions.